Our group is in charge of Alzheimer's disease. Good morning, Ruby. It's time to get up for breakfast.
What time is it?
It's 7 o'clock.
No.
No, you're not hungry?
2 more hours.
Oh, okay. Hello, Ruby. How are you doing this morning?
Good morning, dear.
Are you hungry?
No.
Well, we got some breakfast if you'd like some.
Maybe in a bit, like an hour.
Are you sure?
Yes.
Okay.
I'm sure.
Good morning, sunshine.
Oh, hello.
You look lovely this morning.
Oh, thank you, dear.
Are you ready to show that pretty face to all your friends?
Yes.
Yeah? Ready for breakfast? You hungry?
What's on the menu today?
I'm not sure, but it could be bacon and eggs.
Oh, lovely.
Your favorite.
Yes.
All right. Well, why don't you come with me and we'll start getting you ready, okay?
Okay.
All right. As nurses, it's our responsibility to understand the state that our patients are in. As you could see, Ruby the patient was not ready to eat breakfast and get out of bed the first 2 times. The reason why I left the room and re-entered was because I needed to relate better to the patient and engage client in individualized communication to maximize the client interaction and response. How's it going?
Good, how are you?
Good. So this morning you have a new patient.
Okay.
Her name is Ruby.
Alright.
And she is diagnosed with Alzheimer's disease.
Okay.
So last night we had a little bit of difficulty with her.
Mm-hmm.
She fell and we had to call the physician to come and see what was going on.
Okay.
And do a physical assessment on her just to make sure everything was okay.
Okay.
When we woke her up this morning, she wasn't doing very well.
Okay.
We did have, I went into her room a couple times just because she wasn't really cooperating with, like, getting up for breakfast and stuff, but we got that figured out.
Alright.
So because she is risk for falls, we decided not to use restraints.
Okay.
The reason why we did that was because, according to the CNO guidelines, restraints increase the severity of falls and increase confusion.
Okay.
And we also talked to the daughter of Ruby, and she was on board with not using them.
Alright, cool.
And because of the patient, we asked her if she wanted to be put on restraints, and obviously she said no. So we are refraining from that.
Okay.
The doctor prescribed some medication, new medication that she's on.
Alright.
So you'll have to administer that later on tonight.
Okay.
She doesn't need to be showered or anything. She already did that yesterday before she was admitted.
Okay.
She is a little bit confused today, but she should be okay with her medication later on.
Alright.
And Ruby's daughter's coming in later today, just
Okay.
to discuss the falls and her new medication. So she'll probably want to get some information later on that.
Okay.
I think that's probably about it. She's just finishing up her breakfast now, so you should just be with her in a couple minutes.
Alright, thanks, Naomi.
No problem.
Particularly high risk of falling. Problems with vision, perception, and balance increase Alzheimer's disease, making the risk of a fall more likely to happen. It's important that people with Alzheimer's and those who care for them to take measures to prevent falls. Fall prevention is important for caregivers as well because those who care for a loved one with Alzheimer's must remain mobile and healthy in order to provide the optimal care. People with Alzheimer's are particularly likely to have vision or perception problems. A busy lifestyle or a busy surrounding, for example, may make it difficult for the person with Alzheimer's to navigate around a room. Like similar colored furniture, tables, or carpets may make it hard to distinguish for the person with Alzheimer's. Many medications, including blood pressure medications, can also cause dizziness when the person's standing, lightheadedness, or other problems.
Hi, Mom.
Hello.
How's it going?
Oh, good.
That's good. What are you looking at here?
Just some pictures.
Yeah? Oh, that was you as a child.
Oh.
Yeah, look at how cute you were.
Little dress.
Yeah.
Oh.
Yeah, do you remember that?
Oh dear, that was a long time ago.
Yeah.
Yes.
So how was your night last night?
Good.
Yeah?
I'm very tired, but it was good.
Yeah, that's good. How was your fall? The physician told me you had a fall last night.
What fall? I didn't fall, hun.
You had a fall last night. It was really late.
No, I was sleeping.
Oh, really?
Yes.
Well, we'll talk to your nurse about it, okay?
Yeah, you do that.
Yeah. All right.
Hello.
Hi. Hi, Ruby. How are you doing this morning?
Fine, dear.
That's good. Is it okay if I talk to your daughter for a little bit?
Oh, yes.
Okay. Hello, how are you?
Good.
Okay, so as you might have already heard, your mom had a fall last night.
Alright.
She wasn't hurt, but we are going to be taking some special precautions to make sure that she doesn't have another fall.
Okay. What kind of precautions were you thinking?
So we will not be using restraints as requested by you and also,
okay, yeah.
right?
We'd let the physician know that.
But we will be checking on her more often
Okay.
and using some special signage to alert other healthcare professionals that she is risk for fall.
Okay.
As you can see maybe behind you, there is a sign that says that she's a risk for fall.
Okay.
Okay?
And
And
okay,
she,
yeah.
and she also has on a bracelet on her ankle. You
Okay.
can see it just over here.
And what does that do?
Okay, so it just, if she were to fall, she would be able to alert someone with that bracelet.
Okay.
And on that sign as well, we've also given her a little note, so if she does forget why she has the bracelet on, it tells her that it's for the falls.
So you know that, Mom? You know you have a bracelet on your ankle. If you fall, you press the button, and the nurse will come and help you.
Yes.
Okay?
Okay, also, I just want to talk to you a little bit about if you ever decided you wanted to take her home for the day,
Okay.
there's a few things just to remember because she has a high risk for falls. So, one of the things you can do is remove anything that she could trip over, so books, clothes, whatever.
Okay.
Also, if you have rugs on the floor, it would be better to take them out because they are a risk for tripping.
All right.
Also, just keep an eye on her, if she's going to the bathroom, make sure there's either a bar for her to grab onto or you help her.
Okay.
It's the same with the bathtub. The lighting in your home, as long as your home's well lit, at least she can see everything and won't fall over it.
Okay.
So it's just if you were planning on taking her home at all, just to keep that in mind.
And this is just because, like, with her disease, she gets really confused a lot. So.
Yeah, and it's also a little bit harder for her to perceive objects.
Okay.
So,
Sounds good.
yeah. Also, I want to talk to you a little bit about the medication your mom is newly prescribed. It's called Aricept. It's an
Okay.
anti-Alzheimer's agent.
Oh.
So, yeah. The doctor's prescribed her 5 milligrams per day,
Okay.
and it's to be taken at bedtime.
All right.
Again, if you were to take her home, that would be something you would need to know.
Okay. So, are there any side effects with that?
Yep. The most common ones that we see are dizziness and drowsiness, agitation, confusion. That's something that we take into consideration when we're giving to her at bedtime because drowsiness, you want her just to sleep, right? As opposed to trying to function during the day.
Okay.
Yeah.
Does that relieve like any pain or anything like that she's feeling, or what does that?
It will relieve the symptoms of the Alzheimer's, but I just want to make it very clear that this medication is not a cure for Alzheimer's. Okay?
Gotcha.
Okay.
When's lunch?
Lunch is coming up very soon. Okay, I will come back and get you when it's time for lunch.
Mom, you just had breakfast.
Well, I'm hungry.
Okay.
Give me some snacks.
Okay, we'll be right back.
Yes.
Be with you in a moment, Mom. back again, eh?
Yeah. I just needed to do a mental status test. If you could just close the curtains
Oh,
and
yeah.
get started.
Absolutely.
You're welcome to stay and watch. Hello, Ruby again.
Hi.
How are you doing?
Patient privacy.
Okay. Are you comfortable?
Yes. A
Okay.
little chilly.
I'm just gonna ask you a few questions, okay?
Okay.
Okay. So, what is the date today, Ruby?
The calendar, hon. Can you check the calendar?
Okay. And do you know what year it is, Ruby?
2011.
Okay. What city are we in today?
Well, Newmarket.
Okay. And where are you right now?
We're in the hospital.
Alright. And what's your name?
Ruby Maxwell.
And how old are you?
Turning 87.
Wow.
Yes.
Okay, so I'm going to say 3 words, and when I finish saying the 3 words, I need you to repeat them back to me, okay? As best you can. Ball, car, and man. Okay?
Say it.
Yeah, you say it now.
Ball,
Yep.
man, and car.
Okay. And you know what this is?
Well, yes, pen.
Okay. Very good. Okay, so just to let you know a little bit about why we did that, so we were trying to check her orientation level, you know, like how progressive her Alzheimer's is. So that test to me gave me a little bit of insight into the fact that she's losing her orientation to the time
Okay.
because she didn't know the date and she was a little bit confused about the year.
Gotcha.
But she is still oriented to where she is because she did know where we were today and what city we were in, and herself, obviously,
Okay.
because she knew her name for birthday. So she's oriented times 2 at this point.
Okay.
With the word recall, you know, she just mixed up the words, which is okay. Did you have any questions about your mom's Alzheimer's that I can answer for you?
At this point, I don't think so.
Okay.
Yeah.
Alright. I'll come back in a while just to check on her again. If you wanted to, there's an activity room down the hallway. You know, you can go watch a movie down there, do a craft. But if you have any questions, let me know. I'll be back in about 10 minutes, okay?
Okay, sounds good.
Alright.
Activity room? People has Alzheimer's disease or related dementia.
Alzheimer's disease is the second most feared disease for Canadians as they age.
Did you know difficulty remembering names and recent events is often an early clinical symptom? Apathy and depression are also often early symptoms. Later symptoms include impaired judgment, disorientation, confusion, behavior changes, and difficulty speaking, swallowing, and walking.
Did you know Alzheimer's disease was first identified more than 100 years ago, but research into its symptoms causes risk factors and treatments have gained momentum only in the last 30 years?
Did you know that 1 in 3 seniors die with Alzheimer's or another dementia?
In 2012, 15.4 million caregivers provided more than 17.5 billion hours of unpaid care, valued at $216 billion.
People has Alzheimer's disease or related dementia.
Alzheimer's disease is the second most feared disease for Canadians as they age.
Did you know difficulty remembering names and recent events is often an early clinical symptom? Apathy and depression are also often early symptoms. Later symptoms include impaired judgment, disorientation, confusion, behavior changes, and difficulty speaking, swallowing, and walking.
Did you know Alzheimer's disease was first identified more than 100 years ago, but research into its symptoms causes risk factors and treatments have gained momentum only in the last 30 years?
Did you know that 1 in 3 seniors die with Alzheimer's or another dementia?
In 2012, 15.4 million caregivers provided more than 17.5 billion hours of unpaid care, valued at $216 billion.